drivers, our grocery workers, truck drivers, our pharmacists. Let's be good to them. The stay-at-home order is an opportunity for the rest of us to do our part to protect the people who are on the front lines of this fight and the people who are most vulnerable to its consequences. I ask you to help them out by simply staying at home. You'll be keeping the virus from spreading, and you'll be helping the heroes who live and work in your neighborhoods. Today, I'm issuing a call to action in the fight against COVID-19. We're in the middle of a battle, and we need reinforcements. I'm asking all former physicians, nurses, physicians' assistants, nurse practitioners, and respiratory care therapists who've recently left the field, whether for retirement or a new profession, to come back and join the fight against COVID-19. We need your help now. We'll be waiving the fees and expediting licensure so you can join the healthcare workforce right away. On Monday, your healthcare license reinstatement form will be available on the Illinois Department of Financial and Professional Regulation website. That's at idfpr.com, idfpr.com, and on our COVID-19 website at coronavirus.illinois.gov. These applications will be processed on an expedited basis, and we'll be coordinating with hospitals and healthcare sites throughout the state to deploy these re-enlisted medical professionals to the front lines. Also, for medical professionals whose licenses may be expiring, we are automatically extending your licenses through the end of September. Finally, for healthcare workers living at our borders who may be practicing in cities outside of Illinois, we're going to make it easier for you to also practice here. This will allow health systems in places like the Quad Cities and East St. Louis to deploy physicians where they are needed most on either side of the border. This is heroes' work, and all of you have our deepest gratitude for your willingness to serve. As I mentioned yesterday, we are working to expand the availability of childcare for all our essential workers through a new expedited emergency child care center license to provide care in much smaller group sizes than standard centers. Already, we've had more than 150 centers apply for this license. My Department of Human Services is also developing a grant program to support centers and homes serving the children of low-income essential workers. If you're a provider, an interested organization, a parent or guardian, you can learn more about these options on our coronavirus.illinois.gov website in the coming days. On that note, I just want to take a moment to thank our child care workers from the bottom of my heart. In this time of instability, these providers have remained a silent and steady force of helpers who serve such an important function across the state. We could not keep our essential workers going without your service, and I am so deeply grateful for all that you do for their children. Lastly, let us remember that this virus is not tied to any specific ethnic group or race. People from every demographic, every race, ethnicity, gender, or background have been infected. Suggesting otherwise, or engaging in racist speech or acts, is one of the most profoundly un-American things that I can think of. Instead, the current crisis should drive home to all of us just how connected we all are. We can choose how we want to come out on the other side of this. Let's choose to be one Illinois. I'd like to introduce the Director of our Department of Public Health, Dr. Ngozi Ezike.
Thank you, Governor. Again, my name is Ngozi Ezike, and I'm proud to be part of this administration serving as the Illinois Department of Public Health's Director. I have to share with you the additional cases. We've added 168 new cases, and unfortunately that includes a death. A gentleman in his 70s who resided in Cook County. That brings our total to 753 cases, with a total of 6 deaths. And for each of the families represented by these fatalities, we all offer our support and prayers. This virus is here and it's in our communities. All of your governmental leaders at the local and state levels are working 7 days a week to do all that's possible to mitigate this situation, to lessen illness, and mostly to decrease deaths. What's important now is to try to reduce the further spread and prevent our healthcare system from being overwhelmed. As your governmental leaders do our best, we are asking that you as individuals also do your personal best. Some of the ways you can do that are simple but powerful, and that includes washing your hands frequently for 20 seconds with soap, the social distancing, staying home when you're not well. In addition, you can protect those people who are on the front lines, the doctors, nurses, physician assistants, all the healthcare workers who work so hard to care for those who are sick, including knowing that they could encounter and will encounter people infected with coronavirus. Nevertheless, they go to work every day, putting their health at risk, knowing that they are encountering these patients. I want to also add my thanks for these brave, strong, dedicated men and women. During this unprecedented public health emergency, stocks of personal protective equipment, also known as PPE, are being used rapidly. The availability of critical resources such as gloves, gowns, eye protection, and N95 respirator masks is essential. To maximize the state's availability of this PPE, IDPH released guidance to limit non-essential adult elective surgery and other medical and surgical procedures, including dental procedures, until further notice. We are encouraging strongly all ambulatory surgery centers and veterinarians to donate PPE that is not immediately needed to assist healthcare workers, healthcare facilities, and first responders who are on the front line actively responding to COVID-19. I implore people to do what needs to be done to prevent additional people, including our crucial healthcare workers and nursing home staff workers, from becoming sick. Stay home. Yes, that means sacrificing getting together to celebrate what should be some festive milestones. Let's all stay home so that we can all celebrate down the road. All of our actions have significance. Eye protection and N95 respirator masks is essential. To maximize the state's availability of this PPE, IDPH released guidance to limit non-essential adult elective surgery and other medical and surgical procedures, including dental procedures, until further notice. We are encouraging strongly all ambulatory surgery centers and veterinarians to donate PPE that is not immediately needed to assist healthcare workers, healthcare facilities, and first responders who are on the front line actively responding to COVID-19. I implore people to do what needs to be done to prevent additional people, including our crucial healthcare workers and nursing home staff workers, from becoming sick. Stay home. Yes, that means sacrificing getting together to celebrate what should be some festive milestones. Let's all stay home so that we can all celebrate down the road. All of our actions have significant consequences. For those who won't make these sacrifices, that puts all of us at risk. We are seeing how interconnected our entire community from the top of the state down is. We really want to take care of our medical providers who may need to care for your loved ones if they become similarly infected and need heightened care. The science is clear, and common sense is even clearer. If you don't have the virus, you won't get sick. If you're not exposed to someone who has the virus because you stayed at home, then you don't get the virus, and you don't get the virus, you can't spread the virus. It's as simple as that. Let's stay home and try to keep our whole state as healthy as possible. And with that, I will summarize the points for our Spanish-speaking community. Hoy reportamos 168 nuevos casos de COVID-19 aquí en Illinois. Y con gran tristeza anunciamos una muerte. Un residente del condado de Cook en sus 70s ha muerto. Ahora tenemos 753 casos que incluyen 6 muertes. Sabemos que COVID-19 está en nuestras comunidades. Lo importante ahora es tratar de reducir la transmisión y asegurar